Hey guys, Eric Taysom. This is my Capstone 3 project for treat and rehabilitate injuries for Kinesiology 353. Real quick, my three injuries are meniscus tears, ACL, and hamstring tears. So let's get into those three. All right, the first injury for this project is the hamstring tear or the hamstring strain. In terms of treatment, initially, you would, of course, want to use RICE, rest, ice, compress, and elevate. You could also use NSAIDs as needed or analgesics as needed. You don't need to use them all the time, but of course, if you need them, they're there. It's important that the person who has the injury doesn't return to activity until the injury is completely restored in function. Um, Other treatments concerning exercise. You could do isometric exercise, cryotherapy, ultrasound, um, gentle stretching, jogging, cycling, stationary cycling. Isokinetic exercise can be used in the later stages. And then, of course, these exercises that I'll show you right here for the hamstring tear. All right, the first injury we're going to go over is the hamstring tear and hamstring strain. I have my wife here, Leah, helping me out with the exercises and the stretches for the three injuries. For the first hamstring tear or strain, we'll go over some stretches and some exercises for that one. The first stretch, just simple supine static hamstring stretch. So go ahead and lay on the ground. Lay one foot or one leg on the ground and the other one up here. So this stretch can get the hamstring. You could do it three sets of 30 seconds, and then that should be pretty much good enough for that one. I'm going to go ahead and let that down really quick though. And then for exercises, we could do, I have a list of three that we can do. The first one could be body weight squats. So go ahead and stand up. And for all three of these exercises for the hamstrings, we're going to do three sets of 8 to 10. And that's given that you can actually do the exercises. If you can't, then either don't do them or do less reps as long as it's safe. So for the first one, body weight squats. So go ahead and just do a shoulder width apart with your feet. And then go ahead and do a squat. Try to keep your back as straight as you can. So depth is going to really depend on how your legs are doing and how the injury is improving. Again, like I said, three sets of 8 to 10. A progression for this would be you could put some dumbbells or a barbell on your shoulders and do an actual weighted squat um, or a maybe a weight vest or something like that. Another lift that you could do is lunges, or another exercise you could, is lunges. So go ahead and do lunges. You can alternate both legs. With something like lunges, you don't want to just work out the injured leg only. You want to make sure you do both legs. And then for this one, again, three sets of 8 to 10. And then to make this one harder, you could do lunges with dumbbells in your hands or a weighted vest. Those are probably the two most common, probably most safest ways to I guess, progress that exercise. A third exercise could be the hamstring forward lean. This one, it's a bit tougher, so we'll see if we could do this one here. I'm going to hold on to her feet here, and she's going to go ahead and bend at the knee and then try to come back. Turn that light on, please. Okay, come back. So you get the idea right there from what she's doing. If you've got that down and you've gotten to a point where your legs are doing well, you could hold on to a weight onto your chest, and so that it's even harder to come back up once you've gone, hopefully, a little bit farther than my wife was able to. But that was a good example. Thank you. Second injury, meniscus tears. Meniscus tears, they're a little tricky. Usually, when you injure a meniscus, surgery is needed.
If a surgery is not needed, there are other treatments that you can do to stabilize and strengthen the joint, but oftentimes you do need surgery to repair the meniscus. Sometimes the knee will kind of lock and it won't bend, and you'll get like this piece of meniscus stuck in there, and they might need to take it out, they might need to rearrange, they might need to take some of the torn meniscus out. They pretty much sometimes need to go in there and reconstruct it or do whatever they need to do. And then after the surgery comes the strengthening exercises. If there's a tear in the red or the red-white, red meaning higher vascularity, white meaning little to no vasculature in the meniscus. If the tear is in the red or the red-white, kind of the in-between areas, it will most likely heal because there's adequate vasculature. If there's not, if the tear is in white, you're probably going to look at something that's not going to heal, and you'll probably have some complications later on due to that tear based off of where it was. After surgery, you could do partial to full weight bearing, of course with crutches right off the bat just to start out with. But you'd want to do that as much as possible for the first 2 weeks. Just really start putting gradual weight on the knee. And when you do get a repaired meniscus, if you do have to go get surgery and you do have it repaired, you should wear a brace for 5 to 6 weeks to try to keep that knee relatively still and stable. Of course, you can slowly put weight on it, but you don't want to be swinging that knee all day long. And here's some exercises for the meniscus. All right, the next injury that we are working on with exercises is the meniscus tear. You can't really stretch a meniscus, so we're going to work on exercises that can just strengthen the knee, which will in turn affect the meniscus and help that out. So first we have a range of motion exercise. Go ahead and do the range of motion exercise. And you're going to do 3 sets of 10. It's really there's no weight bearing. It's really easy to do in terms of weight, but if your meniscus, of course, is injured, even this will be hard to do. But a progression with this would be full range of motion. So you'd go from 0 to 90 for the first week or two, and then you begin to progress to where you can almost try to kick your butt there in the back. The next exercise you could do would be a heel slide. This you could do 3 sets of 8. It's a little bit more resistance. So pretty much what you do is you take the affected knee and you bend it. And what you want to do is you want to dig the heel into the ground. So the ground, the friction and the weight of your leg is pretty much the resistance is what you're getting. It's not a whole lot of resistance, but it's just enough to put a little bit more strain on the knee. And you pretty much just bend your leg in. You flex the knee, and you do 3 sets of 8 of that. A progression for that one, where you could always wear an ankle weight, or perhaps maybe if you have really good dorsiflexion, you could always tie like a towel to your foot with like a weight on the end of it and pull the weight. Next exercise could be calf raises. So go ahead and stand up. And calf raises, you could do 3 sets of 10. So just do typical calf raise. No, raise, calf raise, up on your heels. Calf raises. And then a progression of this could be a one-legged calf raise. So once you've got enough strength in the knee and enough balance, hopefully enough balance, as long as you're doing this safe, you could do a one-legged calf raise. You could always hold on to a table or a wall or anything to stabilize yourself as well. The calf raises and as well as the heel slide and all of these exercises strengthen all the muscles around the knee. And they are involved with knee flexion or extension, all these things. So you're not necessarily strengthening the meniscus, you're strengthening the knee. So a lot of people would ask, why would you do calf raises for your meniscus? But if you think about the anatomy, it makes sense. Last exercise I have for this one would be half squats, kind of similar to the one we did for the previous injury, but half squats. This, again, just working knee extensors, hip extensors, And this, of course, with progression, you could always do half squats with a barbell or dumbbells on your shoulders. 3 sets of 6 to 8, depending on resistance or how deep you go, or the severity of the tear of the meniscus. All right, the last injury here for this project is ACL tears. ACL tears for treatment, initially you'd want to use RICE, the rest, ice, compress, and elevate. ACL tears can quite often lead to surgery. The surgery, of course, will depend on your age, your activity, what kind of stress was on the knee, what was being applied to it, and then, of course, the available techniques that the doctor has that he can get in there and do various kinds of surgeries for the ACL. Surgery can be kind of complicated sometimes. Typically, you've got some reconstruction going on where they'll have to take structures from elsewhere in the leg and move them and reconstruct the ACL. They could take parts of the semitendinosus, the tensor fasciae latae, or what's most commonly used would be the patellar tendon, and they would just take a little chunk of that and move it over and fix the ACL with that. With that surgery, you've got a brief hospital stay, of course, for the surgery itself. Then you've got a week of wound protection, and then 3 to 5 weeks in a brace, and then 4 to 6 months, give or take, of course, on the person, and then with their activity and all that, 4 to 6 months of rehabilitation. And then let's look at some exercises and stretches for the ACL. All right, the last injury would be ACL tears. We're going to go over a couple stretches and then some exercises for that. First stretch that you could do would just be, again, like the other injury, would be the hamstring stretch. So go ahead and lay on the ground on your back. So this stretch, again, I've kind of already gone over it. You could do 3 sets of 30 seconds or 2 sets of 30 seconds, just kind of get that loose. And then a groin stretch. So go ahead and sit on your bottom. And these, both these stretches really just get the muscles around the knee again, kind of loosen up the knee, allow the knee to flex correctly and all that. So going into exercises, we've got a real simple one here. Isometric quadricep exercise. It's not going to look like much. Pretty much what you do, go ahead and lay this way on your back, is you get a towel or a pillow or something that's just small that you can tuck under the knee. And what she'll do is she's going to extend the knee. She's going to flex the quads for about 10 seconds. And then she's going to let it go for 3 seconds, and then she's going to repeat that anywhere from 10 times to 20 times, depending on how that feels for her. So again, laying flat, you roll up a towel under the knee. And one way that you can make that one harder is, of course, wear ankle weights and do the same sets, same reps. Let's see, another exercise, static hamstring holds. Go ahead and lie on your stomach, facing that way. So static hamstring holds, on your stomach, sorry. Have the patient or client on their stomach, and then they're going to flex the knee, and then so I'm going to provide resistance. So I'm going to be pushing this way, and she's going to try to bring her heel to her bottom. So this is just isometric here. You could make it harder by providing even more resistance and making it eccentric, or you could start from a different angle. You could start from down here. Go ahead and try to kick your butt, or you can start from even farther in. And getting all those angles will help the range of motion and all the circulation and all that. Lastly, another one could be leg press. I don't own a leg press, but we will get creative with this. So leg press, pretty much you'd see at the gym, or if you have someone willing, you could do leg press like this. And this will just strengthen the legs, the hamstrings, the glutes, everything in the lower legs here. And then to make this one harder, of course, you could add weight. So let me grab my weight.
And of course, more weight makes it harder, and that's a good progression for that exercise.